I'm excited to discuss this. Could the future of wound and burn care be as simple as a spray? Ohio State University is now using a device that creates and then sprays on a new layer of skin to accelerate the healing process. So what is the real deal here?
So this is actually really fascinating. What it is when someone has a true burn, the surgeons will take a small biopsy adjacent to the site, and they actually put it into a device where it's mixed with an enzyme, and over about 20 minutes, you're breaking down the cells and you're actually separating out those cells right along the base of the epidermis at the epidermal junction. Those are called basal cells. And then you're putting it into a solution and spraying it right back onto the wound, which is what you're seeing in this video. Now, this works best for second-degree burns, meaning you still have some of that dermis intact, and you're giving them the cells back they need to help seal that wound much more quickly. And interestingly, we have some great photos of, for example, a motorcycle burn victim. This person had 34% of their body surface area burned, were admitted to the hospital. On the day of treatment, they had this spray applied. 1 week later, you can see how quickly it's healed, and then 2 weeks later, you can see even the progress. This patient was discharged from the hospital in about 3.5 weeks, versus the typical course for burns like this would have been over 2 months. So this is incredibly promising new therapy research.
How quickly were they treating, for instance, that motorcycle accident victim? How quickly were they getting that spray together and treating the wounds?
The day of. So the whole process takes about 20 minutes. It's really fascinating in the device, and that day of treatment was the day the person came to the hospital.
Yeah, for years, we're always looking for a better way when it comes to burn treatment. I hear something like this, I think this is a big advancement.
I'm so excited about this technology because in the ER, you see these burn victims come in and your heart just sinks because you know what is in store for them. And anyone who's ever been in a burn unit knows how horrific it can be and just how painful that process is. And if this even helps with the pain management alone, it's worth it.
But just for our viewers, just quickly to summarize, because we're throwing around all these degrees of burns. Remember, a first-degree burn, you have a nice photo of it there, is limited to the top layer of your skin,
like a
the epidermis. Exactly. Still may cause some peeling, but it's going to be a little red and sore. Second-degree burn is going to go down to the second layer in the dermal layer, and sometimes will cause some blistering. And then, Drew, you have much more experience with these third-degree burns.
Well, the third degree is deeper, that you've gone into or beyond the dermis, and much more serious type of burn there. You're probably going to cover it with a skin graft using this new preparation.
And the great irony of a third-degree burn is because you've literally burned through all of the nerves, it doesn't initially hurt. Correct. Not necessarily, well, and that's sort of the irony. The worse the burn, initially, well, wow, that looks really deep. Why doesn't it hurt?
Deep, you don't have those sensory nerve endings. You've gone beyond that, so you don't feel the pain. But
that's when you need the medical care most. If you are looking at a deep burn and it doesn't hurt, go to the hospital.
You need to. With these burns, so many of the ill effects are over the long term, the contractures, and we always talk about if you have a burn, especially on an important part of your body, your hands, your face, and you have any concerns whatsoever, seek medical attention. And if this becomes ubiquitous, this type of treatment, if you could literally roll in to the ER, and you know, as an emergency department doctor, I see a burn that I think would benefit from this, get the burn team involved, and in the ER, within an hour, because it takes 20 minutes to get the sample and get this formula put together. Within an hour, you've sprayed on this skin.
And not just burns. I mean, any other soft tissue injuries involving the skin, where avulsion injuries or like road rash where you've peeled that skin off. Anytime you've lost skin, this spray on skin may speed up the process.
Do you see ultimately an application where this could be used for cosmetic purposes?
Yeah, I think so, especially maybe after laser procedures, anytime you're heating and taking off the top layer of the skin.
That's an excellent example, because anything we do with lasers, heat, it's a controlled burn if you want, so I would love to try that.
It's going to be great. Welcome to the 90th season of The Doctors, and we'll have all our spray-on skin, we'll still look young, we'll look great.
We'll look just the same. Well, Dr. Ordon does look just the same, so let's be said, you look fantastic.
Funny how that works.